Anybody else feel like August is the Sunday of summer? It is the perfect time to hit reset before the autumn rush. And for me, I start with my wardrobe. Quince proves that you do not need a big crowded closet to look incredible. You just need a few of the right pieces. They specialize in effortless, high quality essentials. Quince has ultra soft organic cotton, premium Mongolian cashmere sweaters, beautifully tailored, built to last, fit properly, and they transition seamlessly from morning meetings to dinner after work. Quince has premium stretch denim that starts at just $50 with the kind of perfect fit and structure and weight that you might look for a long time and only expect to find from a luxury brand. Everything at Quince is priced 50 to 80% less than similar quality brands. They work directly with ethical factories, cut out the middlemen, so what you pay for is quality rather than brand markup. And it isn't just apparel. Quince also brings the same kind of elevation to hotel quality bedding, bath and kitchen staples, essentials, and thoughtfully designed furniture. I am a big sucker for handbags of all kinds. Lately, I have been carrying the Italian quilted stitched sling bag everywhere. I bought it in two different colors, cream for summer, and I will be wearing it in the brown color for fall. That is one of my favorites, and it makes me a fan of Quince every time I get a compliment. Upgrade your everyday. Download the Quince app for app-exclusive offers or go to quince.com/KERA. Get free shipping on your order and 365-day returns. Now available in Canada and the UK as well. That is QUINCE.com/KERA. Picture a stressed out caregiver. Maybe you imagine a spouse looking after an ailing partner, or a member of the so called sandwich generation, someone trying to meet the needs of aging parents and growing children at the same time. Chances are you don't picture a child as the caregiver, but they are out there in large numbers. From KERA in Dallas, this is Think. I'm Chris Boyd. A couple of years ago, a study found that around 14% of school days missed in Rhode Island were attributed to students who had to look after someone else. But it's an issue nationwide. Adults with serious illnesses who can't afford home health services and end up relying on their children or grandchildren for help getting through the day or the night. As my guest will tell us, it can take a real toll, and there's just one organization in the United States explicitly set up to identify and help these families. Helen Ouyang is a physician and an associate professor at Columbia University and a contributing writer for the New York Times Magazine, where you can read her article, "The U.S. Relies on Family Caregivers. Millions of them are kids." Helen, welcome back to Think.
Hi, Chris. Thanks for having me back on.
I have to confess, I had not thought about these millions of child caregivers hiding in plain sight because the work they're doing does mostly take place out of public view, right? We assume when kids are home that somebody is taking care of them. What do we know about how many children, how many families are in this situation?
Yes, exactly. I really had not known of the situation either. The AARP and the National Alliance for Caregiving estimates there's about 4 million kids doing this type of work. And it's really an underestimate. The way they did the survey is they asked adults, are you caregiving for somebody at home who's another adult? And if they said yes, then they asked those folks, do you have somebody at home who is under 18 that's also helping you? So it really does not include kids who are caregiving alone or caregiving for a sibling who might have some medical needs.
You start this piece by telling us about Isabella Miracle Robinson. How and when did she start taking care of her very sick mother?
She's been caring for her mother, Rosa Seda, since she was about 14 years old. That is when Rosa found out that she had breast cancer.
And her parents are divorced, right? But her father actually moved in when his ex wife got sick. Ultimately, though, he wasn't really able to participate much in her care.
Right, exactly. So he moved back in and stayed in their living room. Some of that was more for financial reasons to afford living in their apartments. So he did move back in, but he works full time. So he was not really able to help out that much with the caregiving.
I think we can imagine that children with a sick adult in their lives, might take on a lot more household responsibilities. But what Isabella has started doing goes so far beyond just cooking and cleaning.
Right. Isabella did have household responsibilities, including doing the laundry and cleaning, but she really had to help Rosa a lot after her surgeries. So initially, Rosa, for her breast cancer, she had her right breast removed. And after the operation, there was a tube placed to catch the fluid that was draining. And Isabella had to milk the tube so it wouldn't get clogged. And I've seen these tubes before in the hospital, and Isabella, rightfully so, was frightened about, pulling too hard while she was milking the tube and pulling the entire drain out. She had to help with Rosa changing her bandages, helping her bathe, helping with some of her medications. And then her mother got a little bit better after the surgery, but then she was diagnosed with brain cancer. So the breast cancer has spread to her brain. So then she required two additional operations. And Isabella was very involved with that because at that point, Rosa was having some trouble reading. She was having some trouble writing because the cancer has spread to her brain. So Isabella was helping with making appointments and taking notes during her appointments.
I mean, these responsibilities sound like a lot for, an adult who has a lot of resources. Was Isabella even sort of trained to do all these things that she had to start doing as a teenager?
She wasn't really trained. I mean, I asked her about like when she went to the appointments, it sounded like she would sort of just kind of absorb the information as doctors were talking, but nobody explicitly, spent a lot of time walking her through everything. Um, and she really didn't know how to do some of the stuff, and she had to really figure it out as she went along. So that was really hard for Isabella. Yeah, that was a big challenge for her.
Caregiving, of course, can be a full time job on its own. Isabella has, the full time job of school. How have her obligations to her mom, and as we'll hear, ultimately also her dad, affected her life as a student?
Yeah, in the beginning, she skipped a lot of school when her mother was first diagnosed to help her mother at home. And she was very matter of fact about that. When she talked to me, she said school mattered to her, but really her mother mattered more. And she felt like she wanted to stay home and help her, especially after these operations. And Isabella is a dancer. She was on the majorette team. And those practices and the games would last into the evenings, and she wouldn't be able to consistently help her mom. So she actually had to stop doing that. So she missed school. She missed out on majorette because of her caregiving responsibilities.
How much did Isabella's teachers know about what she had going on at home?
She was close with her health teacher, and at some point she confided in that teacher, mainly because after one of her mother's surgeries, she was having a lot of pain. So she asked her health teacher, is it normal for my mother to be in pain so long? So she confided in that teacher, but there was really no mechanism, to really screen these kids. It just happened to be that Isabella was in this health class and felt comfortable talking to the health teacher because she had a question.
Yeah, it's great that she did feel like she had some adults she could talk to. You actually spoke to that teacher who was frustrated because there weren't great resources she could point Isabella to. I mean, she could help her find information, but she couldn't help with her burdens.
Right. That teacher named Erica Collins, she really felt very upset about what was going on with Isabella. She would talk to her husband at night about the caregiving responsibilities that Isabella had. She would go into a classroom and scream. She would cry a lot. But she really didn't know what to do about overstepping her boundaries. She didn't feel like she could just show up at their apartment and see what was going on. And she also knew that Rosa didn't really have any alternatives. When she came back from one of her hospitalizations, one time she had a really bad virus and her kidneys almost failed, and she came back very, very weak. They sent a physical therapist to the apartment, and the physical therapist would work with Rosa about once a week, helping her to relearn how to walk. But other than that, she knew that Isabella's mom didn't really have any options.
How have changes to the healthcare system created extra responsibilities for all kinds of people who get very sick?
We are definitely discharging people faster and earlier than we have. A lot of that has to do with reimbursements based on the diagnosis and the severity of the disease. So if they expect something to get better in a certain amount of time and the patient just needs a little more time, the hospital might not get reimbursed for that extra day, or they have to fight with insurers about it. So they are pressured by these financial incentives to send people out earlier. And I work in an emergency room and I see patients come back with all sorts of complications, and people are struggling. They go home with these medical devices and they don't necessarily know how to care for them.
I mentioned in the introduction, I was just stunned by this statistic you cite in the article from research that tried to gauge the magnitude of students who are helping parents in the state of Rhode Island. What did that study find again? Remind us of the percentage of school absences attributed to caregiving.
About 14% of the state students reported that they missed school because they had to look after someone else.
So it could theoretically be a younger sibling or something, but it often could be a parent or grandparent.
Right, exactly. The folks in Rhode Island decided that they were going to sort of broaden what they defined as caregiving, so they did include younger siblings.
And of course, in many millions of US households, there is only one adult. So it's not like some other adult is there in the home and not doing their part. I mean, sometimes the only person who can look after a parent or grandparent or guardian is the child who is supposed to be raised by this person.
Right. And, you know, with recent social demographic shifts and how much housing costs, we have more multi-generational families. So then you have grandparents living with children, and inevitably, if grandma needs help, that child is going to help.
Is there any reason why this tends to happen most often in families where the parents have lower levels of education? Like, even if my understanding is, even if people uh, control for family income, the education thing seems to be a big factor.
Yeah, caregiving youth seems to grow up to be adults with lower levels of education. There was this interesting study out of Tufts and University of Minnesota where they actually tracked some of these caregiving children all the way into middle adulthood, so into their mid 40s. And even after controlling for socioeconomic status and other demographics, they really attain lower levels of education. So it really shows that sort of the hits to the children early on, missing school, missing activities, maybe not having as many friends, that really carries on into adulthood.
You mentioned that you work in the ER. I wonder if this reporting project has sort of changed the way you look at the whole family in the room when an adult comes in with a problem.
Yeah, definitely, Chris. As I said earlier, I really had not thought about this. I see both kids and adults in the ER. When I see children, it's never occurred to me to ask if they have additional responsibilities at home. I'm really just taking care of the acute issue in front of me. And I see so many adults who come in with children who have. The majority of my patients are Spanish speaking. So a lot of times the children are interpreting for the parents, often because the parents want them to, or they'll fill in gaps of like what medications they take or when was their last appointment. And it never occurred to me to ask the child what they're doing at home and if it's overwhelming them. My focus has always been sort of on the patient. So even when I know of these situations, it's more me focusing on whether the adult patient in front of me is getting what they need and if they're safe at home. So this has really changed my practice and sort of how I view, as you said, the whole family in the ER.
But then what can you as a physician do about it? Can you call in the hospital social worker? Like, what is your next step?
Right. I mean, I think that's the problem. I spoke to pediatricians who, have talked about like, oh, can we potentially screen? But then it's exactly what you said. What's the next step? How involved can we be? And it's not like the adults at home have better options. So you don't want that adult to get more sick because that's not good for the child either. We do have social workers, thankfully, in the ER who can come at least assess the situation and provide some support. But it's limited what can be done.
And I wonder if some families are reluctant to say there's no other help at home because they're worried about losing custody of their kids.
That's been a big issue. I spoke to experts who talked a lot about that. It's a sort of paradox of child protection. Lawmakers know how to take a child out of a completely unsafe situation and put them in foster care, but these situations are more gray. I mean, Isabella was very loved and cared for by her mother. And when her mother was well, she was cooking for her, able to do things for her. So, what do you do about a situation where a child is doing more than we're comfortable with, but it's not neglect or abuse? And some of these difficulties arise because many states, 42 states, actually have on the books that parental rights could potentially be terminated based on disability alone. So even if there's not necessarily hard proof of neglect. So I think that fear is sort of in the back of everyone's minds.
Helen, the work of caregiving, I mean, it is difficult for the most qualified person under the best of circumstances. But the other component of this is emotional, right? Like, how do children cope with this sense that they might be the only people available to manage their guardian's health crises, the sense that something could go wrong at any moment?
Right. It's incredibly challenging. Studies have shown time and time again that these children suffer from increased anxiety and some from more depression from their caregiving responsibilities. Um, Isabella definitely has gone through periods of both, but there really isn't great support for them. So currently, they unfortunately have a lot of emotional problems from their caregiving.
What has Isabella found to sometimes help her cope with the big emotions around all this?
So Isabella's a writer, and she would write poems um, talking about her mother. And at different points during her diagnosis, it really helped her process some of that. But even sort of towards um, more recently, she hasn't really been able to write very much. She just hasn't really had time. But certainly in the beginning, she would write poems.
You mentioned that Isabella had had to back down from extracurricular activities. I'm curious about her access to time with her friends, which is, important for people at all ages, but just so vital for children and teenagers.
Right. I mean, I definitely felt I observed that just affected her social relationships. She really didn't have that much time for friends outside school, certainly not after school, occasionally on weekends. But studies have also shown that it really can affect friendships. And it seems that caregiving children do have fewer friends compared to their peers.
I was also thinking about the fact in midlife, a lot of my friends have, shared their stories of caregiving responsibilities. And so, like, our entire peer group is going through this at the same time. I would imagine Isabella doesn't have a lot of people in her school life who could even relate to what she's talking about.
Right. And Isabella, she's a little shy, and she can be private. She doesn't like to complain. And she doesn't like to really share. It was quite unique that she opened up to her health teacher, but she was not opening up to her friends or her classmates at all about what she was doing. And even couple years into caregiving, when she started to struggle in one of her classes, she was actually a very good student, A or B student, um, throughout all of this, which is incredible. But she was really starting to struggle in one class, but she did not feel comfortable opening up to that teacher. So no one really knew about it. Her classmates didn't know about it.
What did it take for you to interview her and get her to trust you? I mean, did you spend more time than you might ordinarily just to sort of establish that relationship?
I met Isabella when I visited her school, and she was very shy at first, but she did tell me sort of the broad contours of her story. And then, as you said, after that, it was really, we spent a lot of time texting, we FaceTime. I actually went back and visited her at her home. So I think over time, sort of, she was willing to confide more. But during this whole time, Chris, she was also working. So the whole time I knew her, she had started a job about a year ago. So she was working as well. So she often didn't have time for me, even if she wanted to talk, because she had to go to her job.
Does she Did she tell you that she ever feels just overwhelmed?
Um, I think towards the end, when you alluded to her father also got sick, she did really feel overwhelmed. But I felt up to that point she was almost she was very strong and almost a little stoic about it. Like this is kind of the cards I was dealt, and I'm going to deal with them.
Yeah, I think something else that comes through in the article, and I appreciated that you included this, is that we're rightfully worried about children placed in this position of responsibility that is really far beyond their years. There can be, for some children, like they take pride in this, they feel good about being able to help. Like the obvious answer is not simply removing them from that situation and letting their parent deal on their own.
Right, exactly. I think a lot of the kids gained a lot of resilience and they felt proud of what they were doing. Sometimes there's cultural reasons, and a lot of immigrant families I met and spoke to, they had pride in this. It was part of being a family. It defined their role as a family member. So, experts don't want to take that away. And also, a lot of these kids, they take these skills that they learn caregiving and they apply it to future careers. A lot of them end up going to medical fields, become nurses. So there are positive aspects of caregiving that we don't want to take away.
I don't know whether you talked about this. Did Isabella ever have flashes of feeling resentful that, like, nobody else she knows has to deal with this sort of thing in addition to school and a part time job, but this is her lot in life?
I really never got that sense from her. She, as I said, would be quite stoic about it at times and just really say, this is her situation, this happened, and that's how she's going to deal with it, which is to just by forging forward and taking it head on. So I know she had a therapist, so I know she was getting some support, but yeah, I never heard her express resentment towards her mother, her father. Her siblings, two of them were in the military and they lived far away. One of them actually moved back closer, but they didn't live in the household for most of the time. But she never really expressed resentment about that.
I also wonder what this does, and this doesn't come up in the piece, so if you didn't cover it at all, we can move on. But parent child dynamics. Like when a parent is, for a matter of days or weeks or even months, really dependent on help from a child, then they get a little better. They're able to do more around the house. I wonder about just like, no, you're not going out tonight. No, you can't do this. You must do this. If it's a little harder to restore that parent child dynamic of control and responsibility.
I'm glad you asked that, Chris, because I did observe that with Isabella and her mom. There would be these glimpses, actually frequently, of she's still a teenager and this is her mom. She would, sometimes snap at her mom a little, or her mom would text me, Isabella's just being a teenager today. So there was definitely still that sort of teenager mom relationship going on. I definitely observed that. And I was happy to see that because I could see that is normal for a teenager to be frustrated at their mother. So I was glad whenever Rosa texted me about those moments where when I would see it myself.
Did Rosa talk to you about, her own fears for herself and how she thinks things might go for Isabella if things get worse with Rosa's health?
Yeah, she talked about that a lot. She had sort of reckoned already that her death could come early and that Isabella might be by herself. She really, really wants to see Isabella graduate and obviously beyond, but that's her main goal. She sort of already in her mind had plans in place that if she did pass before Isabella turned 18, that her older sister would try to adopt her. So she definitely was reckoning with that. And, I think really, really just wants to get through the next year until Isabella graduates.
You write in the article about an organization called the American Association of Caregiving Youth. What is its mission?
So, is the only organization in the US that's solely focused on children who are doing caregiving and providing direct services to them. There's some other organizations, some are more disease specific. There's another one called Call for Caring that's working out of Atlanta who actually did some work in Isabella schools where they do some teaching in the schools. But AACY really provides direct services for the children, which is unique.
How did it get started?
So started by a nurse, Connie Siskowski, and she was working on her PhD. And she sort of had the suspicion that there were children who were caregiving. And at that point, nobody really knew the numbers. So she decided to just survey Palm Beach County schools where she was based. And they already did a survey, so she just added on a set of questions. And it revealed this whole population caregiving youth. And it showed that 2/3 were missing school related activities, or they weren't completing their homework, or somehow had their studies interrupted. So she did that in partnership with the Palm Beach County schools. So once that information came out, they couldn't really ignore it, you know.
So, what kind of help can child caregivers find through AACY if they even know about it and are connected with the organization?
Right. So currently ACY, their direct services are only available in Palm Beach County, Florida. They do a lot of national advocacy and research, but for their direct services, so they really go around to a lot of the schools. This I wasn't able to include in the article, but they have these family specialists, and they go into the schools, and they're known in the schools. They're there frequently. They're called the ladies in the red shirts because they wear these red polo shirts. And they're around. They go around to classrooms. They interact with the teachers and teach them about caregiving youth, so they're aware. So they're on the lookout and identifying them. They are out in the cafeteria. They set up tables and they give away candy and chips. So when the students are approaching, they explain about caregiving. They try to ask the students if they're caregiving or if they know people who are. So they can identify the students directly in the schools, or by teaching the teachers and the counselors and even the cafeteria workers about caregiving youth, they get referrals. So they're really very present in the schools. So that's how they are able to screen and catch these caregiving youth.
It sounds extraordinary and like a very important service, and also like one that is probably, could be useful in absolutely every county in the country.
Yeah, exactly. And I know they want to expand at least to neighboring counties, but it's been hard because, each child in the family can take a lot of effort to support them. So they haven't yet been able to fully expand. But yeah, it's something that's needed nationally, exactly as you said.
Yeah, I know for adult caregivers, and again, not everybody is able to connect with these services, but there are nonprofits and sometimes even government organizations, agencies that offer respite care. Is anything like that available to children in caregiving positions?
Right. So AACY does offer respite care. They basically contract with a caregiving agency and they do it that way. But in most places, kids really don't get any respite care. So the Government Accountability Office, they put out a report because they were asked, by some of these caregiving agencies, like what is going on with kids and what are we doing for them? Because all of these services, as you said, are for adults. So after that report came out, they really just made this recommendation that maybe states can be a little bit flexible. For instance, if there's a 17-year-old they want to recognize as an adult and provide them services, with the caveat that only if state law allows that caregiver to be recognized, that kid to be recognized as an adult. So it really doesn't go very far in helping with respite services.
Helen, I know California passed a law recognizing caregiving youth. What is the purpose of that? Is that about these kids who might be 17 and therefore could be treated like an adult?
No, that law goes a little bit farther than that. Nothing's come of it yet, but it's basically directing its Department of Education, particularly its technical schools, to find out how these schools can support them and if maybe some of what they do can be counted for credit. So it's the beginning of something because it's recognizing caregiving youth, but so far it just passed, so they haven't really developed any actual support yet.
What sort of success, going back to AACY, the American Association of Caregiving Youth, what track record do they have in helping clients at least finish high school despite their responsibilities at home?
Right. So if the children to family stores stayed in the program, 98% of them graduate from high school. And that was over the last decade. And if you look at the data from Palm Beach County schools in general, which also include all the AACY students as well, that number is under 90%. So they really do help kids get through school and graduate. And the average child and their family stays in the program for about 5 years. So they really develop long-term relationships with these kids.
How are school administrators in Rhode Island and elsewhere trying to get better at identifying students who might be struggling in class due to caregiving obligations? Presumably, these kids don't walk up to the teacher and say, I missed the test Thursday because I was taking care of my sick father.
Right. So Rhode Island is trying to build their own program for caregiving youth. Um, and this really happened after they sort of changed the graduation requirements to focus more on student readiness rather than seat time. So as part of that, they worked with AACY to develop a program for caregiving youth. So for one, they recommend naming a point person who's sort of known as the person who you can speak to if you're caregiving. So that way, students like Isabella, who was comfortable opening up to her health teacher, but not comfortable opening up to her other teachers, they don't have to keep telling adult after adult about their situation. There's a point person who can kind of spread the word and coordinate their care. They can give more flexible schedules to them. They can let them perhaps use cell phones in class if they're, for instance, expecting a call about their loved one's medical situation. They can give credit for work done outside the classroom or at least give community service hours. And Rhode Island, they had just won a nearly $6 million federal mental health grant. So they are using that grant to train school psychologists and counselors on caregiving youth specific needs. Sort of as you talked about earlier, sort of the emotional effects that caregiving can have on them.
It really is almost hard to fathom, like, being in the headspace to take an exam at school or write an essay in class while waiting for an important phone call about your parents' health.
Right, exactly. I mean, it's unimaginable. And I know Isabella went through that, not necessarily while her mother, was in a tenuous situation or anything, but just that she was allowed to have her cell phone in case her mother just needed her for anything. So that was an allowance that her health teacher gave her.
You also tell us here about a young man named Zion Zebedee Hedgepeth. Tell us about him.
Yeah, Zion, he's very funny, but he lives with his grandmother. He was in foster care very early on when he was first born because his mother was found to have drugs in her system. And his grandmother eventually adopted him. And at the time, she told me that, her family members around her all really discouraged her from doing this. They said, "You're about to retire. No one's really going to be able to help you." But she did it because her son, Zion's father, who has since passed away, told her to go get him. So she did. And as she got older, she really has a lot of healthcare problems. And Zion helps care for her.
Yeah, it was so interesting. You write about him worrying about her driving, like maybe she's not okay to drive. I mean, this is a lot for a teenager to think about on behalf of the person who is, and wants to be taking care of him.
Right. When I met Zion, he was 13. He's now 14. So obviously too young to drive, but he was worried about Suzanne's driving. Now I didn't get in the car with her, so I don't know how she was driving, but he was worried enough. So he would make sure that he was always in the passenger seat during her medical appointments. And he told me he felt like he would be able to see cars sooner than her and call it out and things like that. And he was very jokey about it. But I think underneath all of those jokes, it was really affecting him. At some point, he was having some issues in school. So his grandmother, Suzanne, went to his pediatrician to talk about them. And the pediatrician told her, he's just really worried about you. Like, that's underneath all that.
We talk so much about the unpaid labor put in this country by adult caregivers who are often women. What about these children? Has anyone tried to place a dollar value on the work they're doing at home that is not typical for most American kids?
Right. I mean, they're doing a lot of work. And unlike adult caregivers who, some family caregivers I know in New York, they can get paid as a caregiver. You know, these kids, they can't get that. So we don't have a dollar amount. But what is interesting is, unlike, that classic American sandwich caregiver, the American woman who's taking care of her kids and also her parents, among kids, it's more split between boys and girls. So it's not obviously more girls doing the caregiving for children.
What did you, I mean, I don't want to sound crass, but could money solve this problem? Like if every state or the federal government decided we were going to provide help for these families, would huge amounts of funding toward additional, outside caregivers fix this?
I mean, I think on some level, money would definitely help because, a lot of these families, the studies definitely show they're definitely poorer. So I think if there was more funding for caregivers, that would help. But the problem is we don't actually have these caregivers available to go into the homes. So if the money was used to perhaps raise their salary, maybe we could get more caregivers. But right now, for instance, for Medicaid beneficiaries alone, so these are not people with private insurance who want to just pay themselves for home aides. That waiting list alone is 600,000, and home care aides, they don't make very much. They make less than $17 an hour. There's a lot of labor issues around them. I know in New York, there's an issue where they are required, some places they're required to work 24 hours, but they're only paid for part of that time because the thinking is that they're sleeping for part of the time. They're often immigrants. So there's going to be a lot of trouble even finding these caregivers.
Yeah, has the move to deport people who are not living and working with legal permission in this country affected the supply of home health aides?
Yeah, it definitely seems like it has. There's definitely been some nursing home facilities which, draw from the same pool of caregivers and home aides where they're having trouble staffing. So the thinking is that definitely the home care aides are affected as well, the same as the facilities, and just the fear of deportation will affect whether some of these immigrant home care aides will want to be able to continue working.
There are pros and cons to the different ways countries around the world do healthcare, but a lot of Americans look overseas and think it would be great if everyone had access to care the way they do in some places. What did you learn, Helen, about how other countries are trying to identify and take care of child caregivers where they exist?
Yeah, I think there's definitely a few countries that stand out that have made progress with this. The United Kingdom, for once, first of all, they know that what caregiving children are. The society is familiar with that concept, and they are required, these local agencies are required to identify whether there's caregiving youth. And then if they're identified, both state organizations and nonprofits are expected to sort of fill in the gaps and provide them services similar to what AACY does. Australia, they actually have a bursary. It's, if you speak to folks in Australia, they say the money is definitely not enough, but it's something where, if you apply as a caregiving child for a bursary, you can get some amount of money for your services. And then in Sweden, they really do it out of the healthcare system. So when an adult falls ill, the healthcare workers are expected to screen the adult and the family to see if there's caregiving burdens that are falling on the children and if the child is able to manage it. And if not, they will help, including sending in home care aides.
As an ER physician, would you feel better about your patients' prospects if you were always able to send them home, when they have ongoing care needs with, someone contracted to take care of them who's a professional?
Oh, yes, definitely. I mean, so many people get admitted into the hospital because of a caregiver issue. Often the home health aid agency, like speaking of shortages, they didn't have someone able to come that day. So then, therefore, the patient, at worst case scenario, they fell down and that's why they end up in the ER, or the family member wasn't able to get an aid and the person can't be alone. So they get brought to the hospital and they get admitted to the hospital until the caregiving needs are sorted out. So, and that's always like one of the questions when we're sending people home, like, do you have somebody who can care for you? And if they really don't, they might have to stay in the hospital.
It's also really complicated to manage something as relatively simple sounding as medications, right? Like if somebody leaves the hospital and they've got 8 different things that they need to take at certain times with food, without food throughout the day, are these kids trying their best more apt to make mistakes caring for someone than an adult caregiver?
Yeah, one of the studies that was done was about kids exactly that, making some mistakes, especially with like some more complicated medications like insulin. Zion, he used to help his grandmother with insulin. I don't know if he made a mistake or not, but I think the grandmother decided that maybe that was too much for him. So they are managing complicated medications. It's not even just pills, it also includes injections.
You make the point in the piece that, and we mentioned it briefly earlier, being in a caregiving role at home does not automatically mean a child is endangered. It doesn't mean that they're stuck in a toxic family situation. When it happens that social services agencies get involved, Helen, what might they look at to determine what is best for these children and for the broader families? And are they even in a position to look at the whole family and what it needs? Or do they just have to look at the child and their needs?
Yeah, I think that's a really unique position of AACY. One of the family specialists that I shadowed, she actually came from the Department of Children and Families. So technically, I guess the agency that would take the child away if they felt it was unsafe. And she worked for them for a while. And she told me like pretty strict rules she had to go by. And if the household wasn't meeting whatever criteria she had, she had to jump into action. When she transitioned to ACY, she was able to sort of take, as you said, take the whole family into account. Okay, what's the situation here? Is it truly unsafe? Is there even an alternative? Can ACY provide support by providing respite care or other people to help with household needs and sort of alleviate some of those concerns and see if things get better rather than just removing the child from the home that a state agency might feel compelled to do?
Right, because then you can imagine the adult who needs care is then left completely alone, despite the fact that they haven't, deliberately done anything wrong.
Right, exactly.
Helen, what does Isabella want for her adult life? What sort of career does she dream about?
She really wants to be a veterinarian. She loves animals. She actually had two cats, and they had died not too long ago. But that's her dream in life.
What are the chances that she will be able to continue her education after high school if her care obligations to her parents don't change a lot?
Yeah, that's kind of my fear for her. I mean, Isabella really didn't seem to think about that. She is, very focused on going to college and becoming a veterinarian. But, as an outside observer, even for instance with Majorette team, we were talking about that and how she had to quit, unfortunately, which I was, sad for her that she had to do that. And she was, sort of nonchalant about it. She said, I'll just pick it up when I'm in college. Even though people who really dance at the collegiate level probably have been practicing and gearing their whole dance careers towards that. She was like, I'll just pick my dance career back up in college. So I feared that she might not have all the skills and resources she needs to get there. But I know she's very determined. And as I said, she really was quite focused on her grades. So I hope she gets there.
For anyone who's listening right now, like wondering about vulnerable children and families in our own communities, how can we see these children who are, as I said earlier, hiding in plain sight?
Yeah, I had so many readers write to me after the article about their own caregiving experiences and how some of them nobody knew they were doing it and how they just felt like if a neighbor or a family member had checked in on them, that would have meant everything. Some of them they said it was obvious to the people around them that their parent was sick, but nobody asked, and possibly because in fear of they don't know how to help or to offer permanent resources. So I think definitely we can, check in on our neighbors, on family members. Like if there is somebody sick, well, who's helping that person? If there's a child in the household, is that child doing a lot of work? And I think just being vigilant about paying more attention. I know for me, working in the emergency room, I'm going to start paying a lot more attention to when a child accompanies their family member to emergency room, especially if they're doing a lot of the translating or they're starting to fill in about medical terms or, naming medications. That would be a sign to me this child is probably doing a lot at home.
It does seem like the perfect project for like community groups or, religious organizations. But it sounds like, again, there are just at the moment not a whole lot of groups deliberately doing this work.
Yeah, I think a lot of them are more disease specific. Actually, veteran groups, there's some who help with that. So I think people sort of have to know where to look for resources, which is hard when you're already sick, to have to go out and look for these resources. But even like what they do, it's a lot of work. Like ACY spends, I think, 2,500 or so on a child, and they have it's very labor intensive what they do. I follow the family specialists visiting the homes. I mean, they are helping with everything, like filling out paperwork, helping to get disability benefits, like giving them gift cards. Some people's their homes. One of the children in the article, their home was like falling apart. So ACY doesn't have the resources to fix that, but another staff member rallied her church to go help, but it's a lot of work. And there's not a lot of funding for it.
Did you hear about lawmakers beyond the state level where this is happening in a couple of places paying much attention to this? Is there any federal move to create services for these children?
Really, the GAO report, the Government Accountability Office report, that was supposed to be sort of the national move. And then that they made the change on their national website, the National Family Caregiver Support Program, that, like I said, that they could potentially consider counting an older child if they want to try to give them some adult resources. But it really seems to be happening now on the state level, often a lawmaker who perhaps as a child was caregiving and know about the issue because they have a personal experience in taking the lead on trying to get attention and funding on this.
Dr. Helen O. Yang is a physician and an associate professor at Columbia University, also a contributing writer for the New York Times Magazine, where you can read her article, "The U.S. Relies on Family Caregivers. Millions of them are kids." Helen, it's always nice to talk with you. Thank you for making time.
Thank you for having me.
Think is distributed by PRX, the Public Radio Exchange. You can find us on Facebook and Instagram or anywhere you get podcasts. Again, I'm Chris Boyd. Thanks for listening. Have a great day.